growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi, everyone. You're tuned in to The Lionhearted with Dr. Steve Rasner, a podcast dedicated to maximizing your productivity in dentistry and satisfaction, enjoying the ride as I have for most of my 39 years. So you got one guy's opinion that's done this for almost 4 decades, and it seems that many of you have tuned in over the last year, and I hope this continues to help you. I want to give you a new format today. It's kind of weird. Maybe I'll only do it this time, or maybe I'll hear positive feedback. Since I do these at this point by myself, I'm going to interview me. So let's see if that works. If you have any information you want beyond what you hear as you drive to work, or maybe you're in the gym right now, you can reach me at my name, which is drrasner@aol.com. drrasner@aol.com. And you can find my courses, which I'm having one this weekend, so I'm looking forward to meeting, I know for sure, some of you at the rasnerinstitute.com. So that you'll see where I'm speaking, and maybe you'll come out to my office and take one of the amazing hands-on surgical courses I give, where you can learn anything from implant dentistry to how to take a tooth out atraumatically, to how to graft the socket when you're done taking a tooth out. It's pretty amazing stuff, and I think the words "I'm blessed" are a little bit overblown, but I am blessed that the New Jersey board allowed me to give this course to you, my colleagues, without a license in New Jersey. As long as you have a license in your state and malpractice, you can come to my state and practice these things live, hands-on. So here's the new format. Here's my first question to me. What do I think helps the most in getting paid up front? It is an important part of a successful practice and has a plethora of positive outcomes from nothing else but decreasing stress in the office. So I think the biggest thing of the person that's going to walk in the room and present, hey, this is what it cost, and here are the different ways to work that out. I think the biggest thing is the passion and the confidence and trust that the patient is perceiving from you, the presenter. So where does that come from? It's just like a bunch of words. Looking them in your eye directly. Sometimes when I talk on these podcasts, I tend to do this. I find this way more effective when you're talking to a patient. Your voice and controlling your voice has a lot to do with your sincerity. I don't know. I mean, I hope those of you that are listening to these podcasts are sincere and do care about your patients. And I think that just comes out. And I guess I should say that some of us aren't as good communicators as others. So this is something you can improve on. But one of the things specifically, besides looking them in the eye and, when it's appropriate, touching their shoulder, letting them know you're a real human. I mean, I've had these conversations with patients before, the way I've asked you to, everything you've heard me say in prior podcasts. And I've had patients say to me that the last doctor they went to never even sat down and talked to them. In fact, he not only did not make eye contact, they couldn't see him sometimes because he was in a part of the room and speaking to them where like he was behind the chair. I mean, I don't know about you, but a new patient is how I spend my next couple weeks. If you look at it, it's how I spend tomorrow. Getting patients to trust me enough to allow me to provide the care that they need. Maybe it is an art. I mean, there are a lot of people that are skeptical. Let's be honest about it. It's 2019. There are chains of dental offices where maybe the moral component of that particular chain has not been emphasized enough, and more emphasis has been put on attaining productivity numbers. I doubt that's who's listening to me. But even if you have the most sincere of intention, asking patients to reach in their pocket and part with a significant amount of money based on the very little that insurance companies provide these days is a big deal. And it does require a lot of moving parts from that first phone call to the moment they walk into your door to what happens when you're in that room. You better believe that has an impact. So that's why I'm stressing such detail with you. So one of the things I also like to do is whenever I can accent a positive of their mouth, I do it. And it's just my nature to do that, by the way. But I can't help but notice how many patients seem to comment on that. Wow, that makes me feel better. Geez, at least something's good. I mean, not everybody, but a lot of the patients that come see you tell you what my patients tell me. Oh, this is going to be the worst thing you've ever seen. The worst mouth you've ever had. I had a patient come in last week who was so scared that he told me, I'm sure this happens a lot, I just don't hear it a lot, that he called up several times and just hung up. Then he said he made the appointment before and canceled the appointment and even came to the office once and left. I mean, you and I aren't thinking that they're that caught up on fear. Even I have that practice that attracts these patients, don't think in that kind of detail that actually goes on. So you better believe that once they're in my chair and I've got them there, that I am pretty sensitive to everything that's going down. And one of the things that goes down is me saying, hey, I just got to tell you something. I know you think your mouth's, not great. And it does need a lot of work. But I got to tell you something. You have great bone holding the teeth that you have in your mouth. Your gums need a good cleanup, and there's some tartar we have to get rid of, and we'll talk about all that. So if I can say that, I say that. If that's true, I say that. Or maybe they do have bone loss, but you know already that this is a manageable case. That they're, maybe they have visible recession, but it's not a terminal dentition. So I will say that. Maybe it's they don't have a lot of cavities. So whatever I can accent positively, I'm going to accent positively. Or they'll be obviously intrepid about the upcoming visit. And I will break that down. I mean, I will tell them, listen, here's what's going to happen. You're going to be scared even the night before, even though I'm going to sedate you. And I will have told them already what sedation's about with me. I said, but after that first visit, it's going to change for you. And I'm telling you, I've been doing this now 25 years. That's the sedation part. And I can recognize, I've seen you in my chair, even though it wasn't you, so many times. So the answer to the question is, what do I think is the most important aspect in getting paid up front is the presentation by the doctor. I could spend a whole 5 podcasts on all the details that go into that. But see, because when Michelle, my new patient coordinator and financial coordinator, walks in the room, it's really a matter of, can we fit this comfortably into their world? And if we can, I don't want to do it. I have really changed that way. I mean, look, I know that some of you are just dying to get this whole thing fixed. What I mean by that is, you're taking the courses, because I get your emails. You're taking the courses I ask you to take, but maybe you're not getting enough new patients through the door, and I have something to say about that in a little bit. So I'm telling you, even though that's the case, what I do every day in the part of the world I'm in, southern New Jersey, cannot be unique to me. It's not. You can replicate it. It takes time, and you got to be patient. And when you're kind of desperate and even somewhat bummed out or depressed because your practice, you're putting in a lot of energy, but it's not showing yet. Look, I went through that as well, and I still have times when that happens. But one of the things that will help you down the road will be not feeling you have to get every case. I mean, give it your best case presentation. If you don't know how to fix the case, then don't present it the first day. You always hear me say, first day presentations are really important. If you can give a responsible treatment plan, you bet that's the day to give it. But if you don't know it, then you don't know it. And if they can't accept the treatment and you can't come up with a responsible second alternative, then don't do the case. Give an example. I mean, it's an easy example. They have a lower atrophic mandible. They have enough bone for implants. I mean, most patients do. And they can only afford 2 implants. This is a real case. They have enough money for 2 implants. That third implant with the attachment is going to blow them out. If I want that case, they're getting the third implant on me, to be honest with you. And I'm not telling you to start giving free work away. I'm telling you, that's a whole nother podcast discussion. I structure my fees on the high end of things that I can easily do what I just said. That's just my philosophy. I do that a lot. What I wouldn't do is put 2 implants on a mandible. And I know that's a treatment formula that's in the literature. I don't like it. 3 is my minimum. So that's just one example of how I would handle. And I bring this up a lot in my presentations, and I think it's worthy of you hearing. On that worst day of the worst week of your year, you really need to be sure that the treatment plan you're offering and accepting and recommending to that patient isn't based around the fact that you could use another $10,000 that week. And you know what I'm talking about. And so all of these things I tell you are tied together. When you hear me tell a young dentist that I really like you to live below your means the first 10 years, it's not just because I know that leads to positive things financially in your life. I know it takes the pressure off of you. And you actually, pardon the expression, sell more dentistry with less pressure on you. If the patient perceives one time that what your intent is financial, look, I have patients in my chair weekly, I won't say daily, that one of the alternatives to a terminal dentition is a denture. A denture or an implant retained denture are 2 very different things. The amounts of the end product are very significantly different. But if the patient can't afford an implant retained denture, I will make them a conventional denture. I will. But there's a detail to that process. You need to know that I'm putting in their hand as I'm speaking to them a real denture off a model so they hold it and they know what it is. I find that profoundly effective in communication of that patient understanding, what that alternative might be if they go a denture. They've come in, they may have 8 teeth left, and one of their considerations is a denture. Now, a lot of patients are fine with that. Their parents had dentures. They know what dentures are, but I don't assume that. I will literally have a box of models to my left for each of my presentations, or I'll ask somebody to go get it. And I don't high pressure them. I said, you know what? I love this part of our discussion because I find that visual communication is very important here. So I want you to see what a denture is. And I'll literally put the denture in their hand. And I want them to look. And I'll have the model that it came off of, an articulated model, in my hand. And I want them to see that it covers the roof of the mouth. And that's fine with me as long as I know it. By the way, I do that also for all the types of partial dentures I make, whether it's a Valplast, whether it's a precision partial, where we have crowns made as abutments with precision attachments, whatever the case may be, regular crown and bridge, I have that all. The next question for you, Dr. Rasner. What do you think is the most dangerous, overlooked part of running a rising, increasing, successful dental practice? And that answer to me is that you accept the numbers that you're given by your management. So what I mean by that is even what's in your bank account, that is profoundly dangerous. So there's somebody listening right now who has that one somebody that's been with them from the beginning, and they're like family to you. And I get it. And I am not a distrusting person. I'm exactly the opposite. You need to know that. And I will tell you, that person I'm alluding to they're the ones that never take off. Do you guys know what the embezzlement rate is in the lifetime of a dentist that works for a career? It's close to 70%. Google David Harris and dental embezzlement if you don't want to take my word for it, and look at the articles he has written. Even if it was an embezzlement, even if it wasn't, you need several times a year to look at your own numbers, meaning your bank account statement. Does it match with the numbers that the person in your office is giving you? So one of the benefits, I hope, of this podcast experience with me is that I'm able to turn you on to the connections I've made, not because it benefits me financially, because I'm doing this to help you. So I've come across a new company, to me, they're not new, that they double check your bookkeeping. And to me, that's an amazing peace of mind. And by the way, in the past, I have employed organizations, a forensic accountant. I paid a forensic accountant $5,000 about 8 years ago to check out my accounts receivable. Now, my insurance department at the time didn't tell me to do that. I just had this sense. Do you ever have that sense, like, where is all the money? We take in X amount of dollars a week. It seems like a lot. Where is it? Where are all the channels it goes to? Look, if you're just starting and you're bringing in $100,000 a year or $300,000 a year, you don't need this. But when you get to 500, 800, a million, it's hard to track every number. And certainly those of you listening that are well on your way to maximum achievement, doing several million a year, you need to write to me and you need to employ this. Because I got to tell you, when I did the forensic accountant exercise, I found, and I get paid up front, $230-some thousand on the street of uncollected services, completed services I had provided. So this company can not only tell you that kind of stuff, they can tell you how profitable your hygiene department is. Wouldn't you like to know that? How do you even know what to pay your hygiene department? Maybe they deserve more. Maybe they're being overpaid. I see online all the different dental groups and all the questions that come up. I saw one recently where somebody is paying their staff, their hygiene department, on production. Are you kidding me? Do you understand that half of your production, if you take insurance, is fake money? I mean, not half, but a big percentage is. By the way, I did that for years. I did it. I paid my hygiene team on production, and it's not real money. You can't do that. So, do you get me? Do you see why I'm breaking it down like this? I'm trying to teach you my mistakes. What else can I ask myself? Okay, glad you asked. How about any updates in marketing? I mean, marketing is almost such a pull your hair out moment anymore. Like, what really works? I got some good news for you. I don't just say things to you because I try them out and I get excited. I have to time test them. And there is a company out there that if you write to me, I'll recommend them to you. They're not cheap. They will make a magazine for you. And I know there's several companies that do this. This I've had increasing success with. The magazine is distributed either in racks in local convenience stores in your area. So I don't know if you know this, but if you go into convenience stores or grocery stores, there are racks up against the windows. Usually somebody rents those racks to those stores, and you can put your magazines in there. And of course, we also direct mail them as well. So I am starting to have abundant success that I haven't seen in a long time on external marketing. I have relied heavily, and still do, on internal marketing, word of mouth. And if you don't have that program from me, send someone you love to someone you trust. You need to email me for that. I'll give that to you. That costs me 10 grand. What do I care? If I help you, then it was worth it. It's literally a series of posters. It's how you brand yourself. Send someone you love to someone you trust. I don't think it's a phenomenal saying. And we reward those patients with a $25 Visa card once the patient comes into the office. You got to check your state requirements to make sure that's okay in your state. It is in mine. Let's end with clinical updates because I have a couple tips for you that I want to run by you. One is this. Probably one of the most popular topics in my podcast experience with you is oral sedation. I want to make it clear I don't ever want you to take your patient over 50% on the nitrous in conjunction with the Benadryl, Atarax, and Triazolam. In other words, 50 is the max. The reason is I really think on some patients you can transcend a safe plane of anesthesia and can lose a patient for a few minutes. In other words, they won't know where they're at, and they could be very startled. And it's not. You don't need to. If you can't get them in a treatable position at a maximum of 50%, then I think that's it. And I think it's a safety valve for you. So remember that. Number two, those of you must know by now that surgery, oral sedation and surgery, taking teeth out, grafting, and surgical implants and prosthetics is a foundation of my recommended blueprint for you. But those of you on the very early learning curve, even if you're using a forceps, which I don't even recommend, learn to use the forceps in the following way. If this is my hand and I have a forceps in it, most of you rock left, right, left, right. Even if you're not seeing this on the video, my colleagues, just picture in your head, you rock left, right, buccal, lingual, buccal, lingual. Well, first of all, if you rock to the buccal, you're going to break out the buccal bone. And if you want to put an implant in, that's not what you want to do. Use the forceps when you torque the tooth and hold it for 10 to 15 seconds. That doesn't sound like much. Time yourself without doing it actually on a tooth. Hold your position for 10 seconds and look at a clock. It'll seem like a minute. And what happens is you incite the phenomena of creep, which means you deform the periodontal ligament and the bone until it gives. And if you're not sure of that, what I'm talking about, many of you have experienced in your career a difficult tooth to take out. And so difficult that you took a break. Maybe it was a lower number 30 on a Bruxer. And you did luxate right, left, buccal, lingual. And you had to take a break because you didn't think you were getting anywhere. And you came back and the tooth was looser than when you left. And that's that phenomena in place. And then the last tip is the rule of three. So the rule of three is, in my opinion, one clinician's opinion, I would not sedate children. I would not work on ASA 3s, only 1s and 2s. I would refer my 3s to a hospital environment or at least an oral surgical environment, as in an oral surgery office. It's not that you can't get the teeth out. It's not that you can't do the surgery. It's can you manage the medical complication? That's the problem. Stick to 1s and 2s. Don't sedate children. And no third molars. Obviously, I know many of you listening are very proficient at third molars. I just think the ROI, the return on investment, is very small. And the chance for morbidity of either paresthesia or excessive bleeding in the region of 17 and 32 is not worth the return. That's my opinion. And it's really important to do this journey with as minimal bumps as you can. This journey of a dental career, and that's what I'm trying to do. I'm trying to keep you safe. And you know my numbers by now. And those numbers do not include me sedating children. They do not include ASA 3 type of patients. And certainly I'm capable of taking third molars out, but it's not my thing. So thanks for tuning in. I hope this helps you. See you next week on The Lionheart.